How do I secure the services of a good doctor? With this gun in my hand. A dreary winter morning on Gazpacho Boulevard. The gunfight is over. Indestructible hero by virtue of the fact that he carries a gun, Falk Zildjian has been shot. Don't worry, it's just through the meaty part of the thigh. You need to get that looked at, Falk. I'm fine. It's 1939. You could still get an infection, or it could have hit an artery. Why does everybody always bring up the year? I know what year it is. You don't have to test me on what the date is or who the president is. Who is the president? One of the Roosevelts.
I can help. I'm Nurse Mouseshack from County General. Let's get you there. Where's your car?
I take the bus.
We can't wait for that. Taxi!
I'm afraid I can't allow that, ma'am. Falk Zildjian, step away from the nurse.
What's going on? Who are you?
They call me the Health Access Facilitator. I'm here to help.
You could just call yourself the Facilitator. Except that's pretty vague. You'll have time to brainstorm better names while you step aside and let me get to the hospital.
You must not go to Parabellum City County General Hospital.
Why, are they bad doctors?
No.
Is there some plot to kill me and they know I'll be at the hospital?
No.
Are you from the future and you found out some seemingly minor event will happen at the hospital today, changing our timeline for the worse? Maybe I'll meet a young woman there. Her smile will brighten my day.
That's not...
We'll exchange pleasantries. Later I'll call her and invite her to a matinee. Eventually it will end my bachelorhood, and all the single women of Parabellum City will rise up in a jealous fury, destroying buildings, overturning cars.
No.
Oh, thank God.
County General Hospital is out of network. I'm redirecting you to the nearest hospital that is in network for you. Kafka Health Aggregation Facility Kinship Access, also known by the abbreviation KHAFCA. They were going to call it Kafka Healing and Health Aggregation Facility Kinship Access, but that would have been redundant. Plus the abbreviation would have been KHAFCA.
Health Aggregation Facility, I understand, more or less. What's kinship access mean?
You have to be related to somebody to receive treatment there.
Who do you have to be related to?
Somebody who is authorized to get in.
How do I know if I'm related to someone who's authorized?
Give me your name.
Falk Zildjian.
Nope.
You don't have a list you can check or something? You have all the names committed to memory.
Yes. Mind like a steel trap. Wait, you're Falk Zildjian?
Yeah.
With the radio show?
Yeah.
I've heard of you.
Great. Does that mean I can get in the hospital?
No. Good radio show, though.
There's no time for this. County General is 3 blocks away. Kahafka Hospital will take 40 minutes, even if we slip the cabbie an extra 2 bits and tell him to step on it.
They won't step on it for 2 bits. In my experience, they won't do it for less than 50 bits, unless you've saved their life before and they're in your debt. Even then, you can call on them occasionally as a member of your extended army of irregulars, but...
Please, Facilitator, we have to go now. He's obviously giddy from loss of blood.
You will not pass.
Just to be clear, even if I agreed to this Kafka hospital, would you still block me from getting help because they have a policy of turning away everyone who goes there?
No. There are other gatekeepers to prevent deserving people from getting inside, but that's not my job. I work for your health insurer, Altruisticon Profit Care.
I don't have any health insurance. I'm an independent vigilante.
It's a benefit provided to employees or contractors of the Magnum Radio Network. The executives at Magnum invested in Altruisticon, so for them, instead of it being a labor cost, it's like taking money out of one pocket and putting it in the other.
You must be confused. The studio never told me about this.
Naturally. If you knew about it, you'd use the benefits and they'd have to pay out money once in a while.
But I don't pay into it.
The network withholds medical insurance premiums from your royalties.
Okay. That explains why my checks are so small. Well, I don't want it. Get out of my way. I'll go to County General and pay for it myself.
I'm afraid I can't let you do that, Falk.
Is there any route for a person to get medical treatment in your system?
Yes, under certain conditions it can happen.
What are the conditions?
After your deductibles are met, as long as you haven't hit your annual limit, if there's been no devaluation of the fiscal trisket in the preceding 7 years, if you've never been to a doctor before and your left ring finger is as long as your right index finger, then you can get treatment, after you defeat me in combat.
But he's wounded.
It is what it is. What can you do?
I'm not afraid of you. Why are you doing this to me? Are we reenacting one of Kafka's stories? The Trial?
No, I haven't read that one.
Which ones have you read?
Before the Law and the one with the bug.
Boys, stop that. Stop. Let him go. Falk, you're pulling his face off.
What? Oh no. I swear, I didn't mean to...
I didn't need that old thing anyway.
Under that layer of flesh-colored Bakelite plastic, it's all circuits and wires and diodes. How did they fit that many vacuum tubes in there?
By using efficient design.
He's a monster.
You are no prize yourself, lady.
This gun in my hand is brought to you by the newest drama from the Magnum Radio Network. Serious people call it St. Ignace General Hospital, but the misfits and jokers who run through its halls saving lives call it St. Indignance. Mr. President, you've had a cardiac event and you need medical care. As your doctor, that means I'm in charge. Nurse, get me a Type 3A6 light megazinch flanneal-chronograph twincer stat.
Dr. Udeman, you might be a higher authority than the president in this situation, but if you want someone to find a Type 3A6 light megazinch flanneal-chronograph twincer in this chaotic environment, you'll need to rely on the expertise of a nurse who knows where everything is. That means I'm in charge. Hey, there's water all over the floor of this supply closet. Somebody clean this up, stat.
Nurse, you might be a higher authority than the doctor or the president in this situation, but if you want the bathroom sink to stop gushing water all over the floor and into the supply closet and operating theater, you'll need to rely on the expertise of a plumber who can tighten the ring around the sink trap. That means I'm in charge.
Anyone can do that. Hand me that Allen wrench.
You're gonna use an Allen wrench on a pipe fitting?
Of course, why wouldn't I? Oh, how do you even fit the wrench in that space?
You sure you don't want channel locks?
Fine, I accede to your authority. Just fix it so I can get the chronograph twincers.
Nurse Mouseshack, Mr. Ledford, I'm going to need you to step back from the sink. This wall has to be torn out if I'm going to save lives.
Who are you? How did you know my name?
I'm probationary firefighter Carl Carbondale. I know your name because it's embroidered over your shirt pocket.
Oh yeah, I always forget that.
You may be the highest authority when there's a plumbing emergency, but when there's a fire, that's my time to shine. I don't care if you're the president, or a doctor in the middle of a surgical procedure, or a nurse trying to get, any of that stuff. I'm the one who gives the orders in this situation. I'm the captain now. Not the fire captain, maybe someday, future fire captain, if my probationary period goes well.
Where's the fire?
It came in over the radio. There's one on 14 Mile and DeQuinder.
That's not even in Parabellum City County.
I said there's a fire happening, and you can't obstruct my work.
Excuse me, Officer Carbondale. Is that an abrasion on your left thumb?
I don't know. What's an abrasion?
It's a scrape.
Why didn't you just say a scrape?
Do you or do you not have an abrasion on your left thumb?
Yeah, I got it fighting a fire.
All right, when there's a medical emergency, like that abrasion on your knuckle...
Oh, here we go.
Come on.
You have to defer to my authority as a nurse. Quiet, all of you. I might be a patient and the President of the United States of America, but I'm also a doctor, and that means I'm in charge. You know what they say, doctors make the worst patients, and the worst presidents.
Don't miss this week's exciting episode of Dr. President. Isn't this an episode of Saint Indignance? Whatever, maybe it's a backdoor pilot for Dr. President. Stay tuned to your local Magnum Radio Network station around the clock for whatever shows they broadcast. When we last left our hero, he had torn the face off his opponent, revealing a mechanical man underneath. Who is your master? Who created you? Why are you trying to kill me?
I am a Health Access Facilitator, model number B4T Law. As I told you, I work for altruistic non-profit care, and I'm not trying to kill you. I'm trying to get you the best possible health care while ensuring my employer's profits.
All right, nurse, he won't be a problem anymore. I know how to deal with robots. Watch this. B40 Law, your mission is to get people the care they need, right?
Affirmative.
And your mission is also to ensure profit for altruisticon's shareholders?
Affirmative.
Those directives contradict each other. Medical treatment costs money. The more your company pays to help people, the less profit it will have.
You cannot defeat me this way. Profit is my highest priority. Facilitating medical treatment is secondary.
Drat, they're way ahead of me.
If you refuse transportation to Kahafka, there is one other doctor in network who runs a local clinic. Would you like to see him? His name is Dr. Bartleby Scrivener.
I would prefer not to.
Why not?
I'm supposed to see a doctor recommended by a robot who's trying to kill me?
I'm not trying to kill you. I'm trying to make sure your healthcare costs fit within a plan that will make our shareholders fabulously well-to-do.
Whether or not it kills me.
Yes, but your death is incidental to the economics of the situation, not the goal.
It's just a likely result.
Now you understand.
Does somebody need a doctor? Who are you?
From the rugged Indian Territory, a gangly young dandy in a plaid waistcoat that nearly matches his checkered breeches rides on a mission of mercy. his battered medical bag strapped to the horn of his saddle, clanking and bouncing awkwardly against his hand, which he keeps wrapped around the horn at all times because he's not much of an equestrian. Also, he has a gun strapped to his hip. This is the Gun Doctor. Gabriel Beverly Stalinsky, M.D., was the gun-doctoring frontier metalworker who roamed the length and breadth of...
Yes, I need a doctor.
I too have come to render assistance.
Who are you?
Dr. Intellectual Property Master.
Gosh, I'd almost forgotten about you, Dr. Intellectual Property Master. Nobody's mentioned you since episode 79.
There was a call out for doctors today. I can only enter an episode when I am invited inside.
Remind us again what it is you do.
I ensure the integrity of copyrights, patents, and trademarks, especially with regard to medicines, medical devices, and the books and journals that inform medical research, so that only rights holders will profit from them. But you relax those restrictions when communicable diseases are involved, right? To advance medical knowledge around the world? I said what I said. Damn, I thought I was cold.
Who is needing help at this time? I also have been summoned. It's Falk Zildjian. He's been shot in the leg.
Who are you? Dr. Frederick Wirsum, the gunman who did this to you. Can you tell me how many comic books he had been reading today? I appreciate the help, but I think I'll stick with the gun doctor.
You there! Listen to me, all of you! Is this man currently employed?
Who, me or the robot?
You, Falk Zildjian!
I'm self-employed. Why do you ask?
When you were terminated by your previous employer, you qualified to continue paying for and receiving health insurance coverage while you were between jobs. It's more expensive, but it might tide you over. And it's all thanks to the Consolidated Omnibus Budget Reconciliation Act, also known as COBRA!
Why are they firing ray guns?
It's just what they do.
Not on our watch. Warlords! Formerly known as G.I. Jake! Stop. You must cease this madness.
Who are you?
I am the Sorcerer Extreme, Dr. Strange. There are enough healthcare professionals gathered that we may now perform the ritual.
It's okay. He's a good guy, I think.
Silence. What will be the cost of this procedure?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
13.
What's the purpose of this ritual, Dr. Strange? Is it part of the hazing process for would-be doctors known as residency?
No, Falk. This is powerful and desperate magic. When you're not sure how to wrap up an episode, this ritual creates an exciting cliffhanger ending. But in future episodes, no one who is involved in it may reveal how they survived.
You don't mean...
I do.
Go to Health. Episode 123 of This Gun in My Hand was doctored by Rob Northrup. This episode and all others are available on YouTube with automatically generated closed captions of dialogue. Visit thisguninmyhand.blogspot.com for credits, show notes, archives, and to buy my books, such as Sisyphus Eat Your Heart Out, available in paperback and ebook from Amazon. How do I ensure every episode goes out with a bang? This gun in my hand.